Hi, this is Dr. Cordy. The second type of PCOS that we're going to talk about just briefly is PCOS that's caused by taking birth control pills and actually stopping taking birth control pills. So, one of the reasons you take birth control pills is because you want to stop pregnancy from occurring and you want to stop ovulation from occurring. And so, that's exactly what happens. Your hormones are suppressed to an extent that it doesn't allow your body to naturally ovulate on a monthly basis. That's the goal because you don't want to get pregnant. The other thing that happens when you take birth control pills hormonally is your androgens, or your DHEA and testosterone and androstenedione, are suppressed. And so you'll have lower levels of those while you take the birth control pills. But then when you come off of them, that synthetic or external suppression is no longer there. You're not taking the pills anymore that suppress those. So your body sort of bounces back and then tends to create a lot of them relative to what it was creating in the past with the medicine. And so you'll see things like oily hair, oily skin, acne, maybe even some hair growth on your face or hair loss on your head, especially like a male pattern hair loss on the top or on the sides a bit here. And sometimes you get a little bit of a hair growth in the middle of the chest or middle of the belly, just like we see with PCOS patients who haven't been taking birth control pills at all. And we'll see this same pattern. Now, if you didn't have PCOS prior to starting birth control pills and you get it after, usually over time it will resolve itself. But birth control pills also come with another variety of problems because they create deficiencies of a variety of minerals, including zinc and magnesium. And they also create deficiencies of B vitamins, sort of globally. B vitamins will become deficient when you take birth control, especially B6, which is important for fatty acid metabolism and energy, lots of other things, of course. B vitamins are good for lots of things all over the body. But over time, when you take birth control pills, those all become deficient. And so when you stop taking them, there's a bounce back of hormones. So we get sort of a surge of androgen production, which looks like PCOS, and it may be temporary, but you also have these deficiencies that if you haven't been taking supplements during the time you were taking birth control pills, and if you don't start taking supplements after you stop taking the birth control pills, those deficiencies will continue to be present, sort of ongoing, and may slowly correct themselves with a good wholesome diet and lifestyle, and may not. It just depends on how deficient you are and other factors involved with how well you sleep and how well you eat, if you eat enough protein, if you get enough good fats in, enough good global consumption of lots of like a rainbow of foods that have all of the vitamins and minerals that you need to replace from the medicine that you were taking, and also that you need to just stay healthy on a day-to-day basis. So sometimes when people take birth control pills and they stop, they will slowly over time just recover from this PCOS-like induced condition as their system just recovers on its own. And sometimes some bodies just don't recover as well. It might even take a few years for that to happen. And so they need to do a little bit more than just wait for it to get better. And they need to treat it a little bit more naturally with a more aggressive kind of program or plan. We can talk about the treatment of that in another video, but this is the second kind of PCOS, which is the post-birth control pill kind of PCOS that, again, is typically brought on by stopping the pill and then watching that surge of androgens come back and create some of those PCOS-like symptoms. Thanks. I hope this is helpful. We'll continue in the next video with the next kind of PCOS.